Diabetes mellitus is a complex metabolic disorder that affects millions worldwide. While most people are aware of its impact on blood sugar and internal organs, fewer realize how commonly it leads to musculoskeletal or MSK complications. These disorders can range from joint pain and stiffness to more severe conditions that limit mobility and quality of life. In this video, we'll explore how diabetes contributes to MSK problems, the types of complications that can arise, and why early recognition and management are so important for those living with diabetes. Let's begin by understanding just how widespread these issues are. Musculoskeletal complications are surprisingly common in people with diabetes. Studies show that between 34% and 83% of individuals with type 2 diabetes experience some form of MSK disorder. These complications are more frequent in those with higher body mass index, older age, and additional health issues like nephropathy. For example, osteoarthritis is seen in nearly 1 out of 5 diabetic patients, while shoulder capsulitis and carpal tunnel syndrome are also prevalent. The risk is notably higher compared to the general population, making MSK health a crucial aspect of diabetes care. What's behind this strong link between diabetes and musculoskeletal disorders? The answer lies in the chronic, low-grade inflammation and metabolic changes that diabetes brings. High blood sugar leads to the formation of advanced glycation end products, or AGEs, which accumulate in tissues like bones, cartilage, and tendons. These AGEs disrupt normal tissue structure, promote inflammation, and accelerate tissue age. Additionally, diabetes-related nerve and blood vessel damage further contribute to joint and muscle problems. Understanding these mechanisms helps explain why MSK issues are so prevalent in diabetes. A wide range of musculoskeletal disorders can develop in people with diabetes. Some of the most common include osteoarthritis, adhesive capsulitis of the shoulder, carpal tunnel syndrome, and Dupuytren's contracture. These conditions often present earlier and more severely in diabetic patients than in the general population. For instance, adhesive capsulitis, also known as frozen shoulder, can cause significant pain and limit movement, while carpal tunnel syndrome leads to numbness and weakness in the hands. Recognizing these patterns is key to timely intervention. Diabetes particularly affects the soft tissues around the joints of the upper limbs. Arthropathy, for example, is a diabetes-specific hand disorder marked by thickened skin and finger stiffness, often detected by the prayer sign. Other hand issues include trigger finger and Dupuytren's contracture, which cause painful nodules and contractures in the fingers. Carpal tunnel syndrome is also more common, leading to tingling and numbness, especially at night. These conditions can significantly limit daily activities and hand function, highlighting the need for early detection. Bone health is another area impacted by diabetes. In type 1 diabetes, bone mineral content is often reduced, increasing the risk of osteoporosis and fractures. In type 2 diabetes, bone quality deteriorates even if bone density appears normal. This means that diabetic patients may be more prone to fractures, especially if they have neuropathy or vision problems that increase the risk of falls. Some diabetes medications can also affect bone metabolism, so treatment plans must be carefully tailored to each individual's needs. One of the most serious MSK complications in diabetes is diabetic foot syndrome, which can lead to ulcers, infections, and even bone infections like osteomyelitis. Peripheral neuropathy and poor blood flow make the feet especially vulnerable. Charcot neuroarthropathy is a severe non-infectious condition that causes joint destruction and deformity in the foot, increasing the risk of ulcers and instability. Early recognition and specialized care are critical to prevent severe outcomes, including amputation. Early identification of musculoskeletal disorders in diabetes is essential for effective management. Symptoms can include joint pain, stiffness, swelling, and reduced range of motion. Some conditions, like arthropathy, can be detected with simple physical tests, while others may require imaging or nerve studies. It's important to differentiate between MSK disorders caused by diabetes and those from other causes, as this guides the best treatment approach. Regular screening and awareness of early warning signs can make a significant difference in outcomes. Managing musculoskeletal complications in diabetes requires a comprehensive approach. Optimal blood sugar control is fundamental, as it helps slow the progression of tissue damage. Physical activity, weight management, and movement-based therapy are key to maintaining joint health and mobility. Pain relief, physiotherapy, and sometimes assistive devices can improve quality of life. In some cases, medications or surgery may be needed. Importantly, early intervention and a proactive approach can prevent many complications and help people with diabetes stay active and independent. In summary, musculoskeletal complications are a significant but often overlooked aspect of diabetes care. From joint pain and hand disorders to serious foot problems, these conditions can greatly impact quality of life. However, with early recognition, proper management, and a focus on prevention, many of these issues can be effectively addressed. If you or someone you know has diabetes, staying informed and proactive about musculoskeletal health is a vital step towards long-term well-being.